you give a young female hormonal birth control, you're giving her a medication that is going to cut the brain off from the gonads. Hormonal birth control is known to decrease the metabolic rate. Impaired carbohydrate metabolism. It absolutely impacts fertility. Cervical atrophy, change in the cervical mucus, decrease in egg count. You're basically putting this young female into it's like menopause. And when you give a young female, a female of any age, doesn't matter, hormonal birth control, especially a systemic version. So oral birth control being the most common. Some of the implantable types of, Nexplanon would be another really, really bad one. Anything that's given that can be significantly systemic and or have the ability to cause a shutdown of the HPG axis, right? Hypothalamus, pituitary, gonads, which would be ovaries for the females. Anything that can disrupt that and disrupt a cycle, disrupt the corpus luteum from forming, and progesterone and estradiol and all these sorts of things, we are going to end up with no endogenous hormone production. What do I mean by that? I mean that we are literally preventing a female from producing her own estradiol and progesterone. Now, are we replacing that by giving her a Franken-like hormone substance via the hormonal birth control? No, we are not. Do you know why? Because they're not the same thing. And they don't have the same rates of efficacy in any way, shape, or form. And they carry lots of risks, which we're going to get into in a second. But so imagine what you're essentially doing to a young female is chemically castrating her. You're giving her a medication that is going to cut the brain off from the gonads, completely squash that whole messaging system, prevent hormone from being endogenously produced and released largely. And so you're basically putting this young female into it's like menopause. I mean, for God's sakes. And the repercussions are enormous, absolutely enormous when we do that. So this study in particular tried to break all these different things down as best as it could, because there's a lot. And I think we're going to continue learning about this, by the way. I don't think this is like the tip of the iceberg, I think. First and foremost, hormonal birth control is known to decrease the metabolic rate. And if you know me, I'm psycho about metabolism in a good way. I want robust metabolism. Every single organism requires the most robust metabolism possible to create the most efficient amounts of energy while also lowering the amount of oxidative species that are produced, right? To get the most energy possible to maximize the structure and function of the human being, top to bottom, right? When it comes to your brain, your heart, your liver, your skin, the way you think, the way we operate on a day-to-day basis is literally based on the currency of energy. And that currency of energy is pushed through via our mitochondrial health and function, which maintains our metabolism. And if we, in any way, shape, or form, dampen our metabolism, God forbid, even if it's just by 5%, is that going to have a long-term impact? Absolutely. So over 3 months? No. Negligible. Over 3 years? Certainly more. How about 30 years? Spin that out. It's a lot more devastating. Hormonal birth control lowers the metabolic rate. Now, the old school, first gen hormonal oral birth controls especially were really hard on metabolism. We saw much more weight gain and things of that nature. We see less of it, but we still see it. It's not gone. So we see an increased rise in obesity in females on hormonal birth control in comparison to counterparts who are not. We see an increase in things like LDL and fasting blood sugars. We see an impaired carbohydrate metabolism. That's really key. Again, for those of you who have taken the HRT University Master Course, you're going to be like, oh, no wonder Nico talks about metabolism and carbohydrates so much and all these things that what the heck does this have to do with hormones? It has a lot to do with hormones. First of all, your hormones directly influence your metabolic rate. Progesterone, very significantly. I mean, progesterone literally is directly involved with enhancing the health of the mitochondria and the biogenesis of mitochondria, making more of them. Well, guess what happens if you take progestin and you get rid of your body's ability to produce progesterone practically entirely? Do you not think your metabolic rate would slow down? Do you not think your mitochondrial health would suffer a little bit? See where I'm going with that? That is really, really bad news. Carbohydrate metabolism is quintessential to the health and function and structure of the human being. And we're destroying it, completely destroying it in many ways, just by adding in hormonal birth control. And is that going to give rise to metabolic dysfunction? Yes. Is that going to give rise to wonky blood sugars and weight gain? Absolutely. Yeah, of course. That's just number one. Number two, this is something that I found really interesting because, I had a lot of female patients when I first started doing hormone replacement therapy for young women and really focusing especially on helping women with fertility issues. What was very clear was that a lot of the young ladies who took oral birth control or had a history of taking oral birth control for many years had much greater difficulties than women who didn't. And again, it was confusing because I'm just an N of one in my clinic, right? But it was something I felt like I came across all the time. And the patients would ask me, Nico, I just wonder, I was always told that hormonal birth control had no impact on my fertility at all. Is that true? Because I feel like it did. And, to be honest with him, when I first started, I would say, I don't think so. I think the literature is pretty clear. Well, guess what? The literature's pretty clear that it absolutely impacts fertility. What do we see? So what we especially see is that women who have taken hormonal birth control for greater than 10 years, especially greater than 10 years, we have an increase in basically the aging of the ovaries. We see cervical atrophy. We see a change in the cervical mucus. We see a decrease in egg count, which we can literally see by checking a anti-Müllerian hormone. I mean, we're seeing all these things in real time in the literature. This is not me just like making stuff up here, guys. Sagara et al., that's what they discuss in this article. Does hormonal birth control impact fertility? Yes, it does. And we have to stop gaslighting women who are coming in and talking about how they feel like they're crazy because they're having fertility issues. It's not crazy. It's not crazy at all. You're right. It is. And you know why? Probably because that hormonal birth control, amongst many other things. I mean, the fact that our hormones are not good anyways because of all these environmental toxins and pollutants and chemicals and blah, 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 and lifestyle factors and decreased nutrients. Again, I'm not just blaming hormonal birth control singularly on that whole thing, but it is a part of it. And it's a much bigger part than I think any of us give it credit for. And not a single one of us is giving informed consent on that. Well, I don't prescribe hormonal birth control, but let's just be real. I don't know of anybody in the world of OB-GYN, in the world of primary care, in any capacity, if you're providing hormonal birth control, have you ever given informed consent around like decreased metabolism, a decrease in fertility if taken beyond 10 years? Like, have you ever had that discussion with a female? Probably not. And by the way, I'm not disparaging you or like shaming you. Really, did you know that? I didn't know that many years ago. I had no idea. I never gave oral birth control, but I'm just saying a lot of us are put into positions and we're giving these medications because everybody else is doing it. We were taught that's what we were supposed to do in school and everything's fine and don't worry about it. Boy, you see how frustrating that is? It's really frustrating. Let me keep going. So, what other impacts does hormonal birth control have? Did you know that hormonal birth control significantly increases the risk of cardiovascular disease? Specifically, we see a 43% higher rate of heart attacks, MIs, and clots, VTEs, in women who have taken hormonal birth control in comparison to their counterparts who have not taken hormonal birth control. 43% higher. Has anybody been told about that? I think clots is probably one of the few things that I've ever heard. Like, if a female comes in and is asked about birth control and, well, have you ever thrown a clot, or do you have factor 5 or blah, 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 blah? Because that would, be a contraindication if you smoke. Like, those are things I've heard. But the heart attack and MI thing, I've never heard that. And by the way, it's the same rate. 43% increased risk of an MI. By the way, 43% increased risk of hypertension as well. That's startling. Those are really big numbers, and we should be telling females about that. At the very least, if we're continuing to prescribe hormonal birth control, we should be telling women that is a likelihood that you may develop cardiovascular disease and hypertension. By how much? By about 43% in comparison to your counterparts. What are the other issues? Well, hormonal birth control significantly increased the risk of autoimmune diseases. Yeah, significantly. What types? We see in the literature multiple sclerosis, Crohn's disease, ulcerative colitis. We see systemic lupus. And we even see things like interstitial cystitis, which, again, not really an autoimmune disease necessarily. I mean, maybe to some degree it kind of is, but we see significant increase in inflammatory disorder because we are lowering the metabolic rate and we're getting rid of hormones, i.e. progesterone and estradiol, that are produced endogenously to protect a young woman from all of these things. So funny, because all of the things that I just mentioned are much more common in women who are, beyond perimenopause especially, which is ironic because they don't make any more progesterone and estradiol like they did when they were in their 20s and 30s. Fascinating, right? It's as if getting rid of the bioidentical hormones that our body produces and not replacing them with bioidenticals, but actually replacing them with Franken hormones that frankly make all of those things even worse, is coming to light. And that's exactly what we're seeing. Thank you so much for checking out this clip and tuning in. I hope you enjoyed it. If you really liked it, I definitely recommend that you click here to watch the whole entire video where I go into much more detail. Thank you again for joining, and I'll see you there.